I'm interested in are moving away the people who have made really bad decisions. For example, on the nutrition guidelines, people who have, there's people at NIH that were involved in the amyloid plaque scandals that derailed Alzheimer's treatment for 20 years. It's all corruption. Those kind of people need to be moved.
Robert F. Kennedy Jr. discussing his plans for the National Institutes of Health and its employees as the newly sworn-in Secretary of Health and Human Services. And for more on this and the removal of the COVID vaccine mandate for schools, we welcome Dr. Robert Redfield, who previously was the head over at the CDC as well. Doctor, so great to have you with us this afternoon. There are a number of directions we could take this conversation, but in the interest of brevity, I think it's important that we acknowledge there are millions of Americans who are incredibly, intensely interested in what's going to be happening at HHS with Bobby Jr. Over at the helm. What's your impression of what you're hearing, not just from your friends in the administration, but also broadly in the medical community about the change?
Yeah, I think RFK will become the most consequential health secretary our nation's ever had. He clearly is on a mission to, as he points out, to make America healthy again. It's very sad that really what's happened over the last 30, 40, 50 years is our nation's become progressively sicker. One of the reasons we lost 1.2 million people during the first couple of years of the COVID outbreak, and many other nations lost far fewer, is that we're a sick nation. And I think Kennedy has a really good plan on how to address chronic disease, including the highly processed foods and the dyes and the additives in our food, but also getting our research programs to focus on improving our way to treat and manage chronic disease. So we begin to convert our current system, which I've been part of for now almost 45 years, which is a disease system. Let's convert it to a health system so that we can recapture the American public so that they're healthy. It's hard to believe that over 50% of adults in America have a chronic disease. It's even harder to believe that 77% of our young people that want to join the military can't pass the medical exam. It's really time to have an aggressive transformation of our approach towards healthcare. And I think Kennedy's going to do that.
Yeah, I think that's the sense, certainly from laymen like myself. We hear and we read different things about his perspectives, and it seems like change is afoot. I do want to share this. This was part of a conversation, Doctor, between Robert Kennedy Jr. and our Laura Ingraham, talking about the impact Big Pharma is also having on our health outcomes. Listen to this.
I have a list in my head, and we have a generic list of the kind of people that, if you've been involved in good science, you got nothing to worry about. If you care about public health, you got nothing to worry about. If you're in there working for the pharmaceutical industry, then I'd say you should move out and work for the pharmaceutical industry.
He's talking about the impact that Big Pharma has had, not just on our health outcomes, but also on our prospects to try new and different approaches to making Americans healthy again. Do you understand where he's coming from?
Yeah, I think there's a concern that RFK has that a number of these agencies, he uses the term corporate capture, that they're much more engaged in the priorities of the private sector entity, in this case, Big Pharma, than they are in the general issue of trying to research and improve health. It's interesting that one of the things that negatively impacts the pharmaceutical industry is obviously if we figure out how to effectively treat something without medication.
Right.
We have a health system right now whose answers to most problems are medication, 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 medication. We've seen that with, our mental health programs, et cetera. I think Kennedy is really going to be aggressive in trying to advocate that we take a fresh look at the way we approach disease management and chronic disease. And I think it's going to be a breath of fresh air.
And I think a lot of Americans, frankly, are really ready for it. That and the idea that the Trump administration is saying, listen, you can't compel people to take the COVID-19 shot in order to go to school. That change, too, will make a difference, I suspect. Dr. Robert Redfield, thank you so much for your time today, sir. We certainly appreciate it.
Thanks for having me. God bless.
Thank you. God bless.